work out.
I'm so sorry.
Yeah, it happens. And that was the thing in the beginning. It was like, okay, God, we know just wasn't your timing, and that is all right. We will bounce back and figure our way through it. And got pregnant again in the spring, and it didn't work out. Got pregnant again early 2018. Didn't work out. So at that point, it was just kind of like, okay, like, what's the deal?
People may be surprised to know that 1 in 10 women will miscarry in the first trimester of pregnancy. Miscarriage is something that most people don't talk about publicly, but recently more celebrities, as you just heard, are sharing their stories. Of course, that was Carrie Underwood. She just recently shared that she suffered 3 miscarriages in the past 2 years before announcing she's expecting her second child. Today, we're joined by Dr. Jordan Coet, an OB/GYN with Stanford Health, to kind of discuss miscarriages and what women should know and why maybe we're hearing more about them now. Thank you so much for joining us today. In some ways, I mean, it's a hard topic to talk about. It's sad, and yet we are hearing people talk about it more. Can you start with just kind of explaining, you know, what is a miscarriage and why does it happen?
So a miscarriage is the loss of a pregnancy before 13 weeks. That's an early pregnancy loss. Why they happen, 50% of all of those are from chromosomal abnormalities in the fetus. After that, some of the other causes can be clotting disorders in the mother, infections, things like that. Actually, most of the time we don't even know why.
And I feel like we're all touched by this, but it's something that a lot of people don't talk about, but I've had colleagues, really close friends. Why do you think we are talking about it more?
I think now in the social media age that we are in, some people feel like it's easier to share, and they see celebrities like Carrie sharing, and they find it to be not so taboo anymore. Even 10 years ago when I started, it wasn't as readily shared, but I would tell people, well, if you just talk about it with somebody, you'll find that more and more people that you know actually had a miscarriage and you didn't even know because they hadn't shared about it.
They hadn't shared, but I also feel like women, we all know now way sooner that we're pregnant, like within a week almost, versus in the past. You know?
It's almost like a lot of us are so type A and are tracking our cycles and are trying to get pregnant and are, we know to the date when it happened, and we're using at-home pregnancy tests, so we know when that turns positive. So we kind of know our bodies from the beginning.
Can you talk a little bit about 2 different things here? Physically, there are some things that can happen that you do have to still see a doctor. Sometimes you don't after a miscarriage, but also emotionally. I mean, Carrie Underwood was in tears, and I've had, you know, visits with friends who were also emotionally. It's so difficult and hard for other people to understand unless you've experienced it.
Correct. So physically, when we want you to see a doctor is when there's heavy bleeding, pain, things like that. Complications from a miscarriage can be not completely passing the miscarriage and needing a medical procedure, which can lead to needing things like blood products, things like that. Rare, but it does happen. But I think, like you said, the overlooked part is the grief, the anxiety, especially with the next pregnancy, the grief of losing the first one and not having told anybody or keeping it to yourself or with just you and your husband or you and your partner.
I feel like a lot of people mean well when they say this, but it's easy for people to say, it's okay, it wasn't meant to be, it'll happen when it's right, which is true, but that's not always the right thing to say.
Right. That's kind of just when we don't know what to say, those are the type of things we say, and it makes us feel better, but the person that it's happening to, you know, wanted that pregnancy and wanted that one at that time. And they know that whoever the creator has a plan, but they want to control that plan.
Can you have a healthy pregnancy after a miscarriage?
Yes. Most people go on to have a normal, healthy, no-issue pregnancy after their first miscarriage.
And well, with Carrie Underwood's story, but she had several.
Yes.
I mean, that seems like that might be, there was something else going on.
Right. It's more uncommon, but having 3 miscarriages in a row or 3 miscarriages total, we as physicians start to want to look behind the causes of what's going on, what is causing this person to have multiple losses, and we'll start to look deeper into the medical reasons.
How do you feel about people talking about it more? I would think this is a good thing to start the conversation, that someone like Carrie Underwood, decides to share.
Yes, it's not a taboo topic. Like if 1 in 10 pregnancies have a miscarriage, then that's a lot more people than that that have experienced and can help you get through and help you grieve and help you move on.
And talk to your provider if you're dealing with any of these issues.
Yes, exactly.
Well, thank you so much for coming in and visiting about a topic that a lot of people don't. So I appreciate it. All right, stay with us. Coming up next, we are showing you today's strategy for tomorrow's interest rates.